It has been 7.5 decades of service by the World Health Organization to humanity. It is stressing the need for a renewed commitment to health equity, which will be the key to addressing future health challenges as the global community marks the World Health Day with the theme, Health for All. Health correspondent Kemi Balogun takes a look at how Nigeria has fared in actually providing health for all.
In the African region, about 25% of health expenditures come out of people's pockets, and as a result, hundreds of millions of people are further pushed below the poverty line due to spending on health. One major aspect of the drive to achieve health for all from the perspective of the World Health Organization is the attainment of universal health coverage. This seeks to provide affordable, equitable and sustainable health care to all its citizens. For this to be achieved, two key themes need to be addressed: health insurance and the improvement of the primary healthcare system. These two remain largely unachieved.
These activities in the community, and we have the data that have shown. And for in the aspect of HIV, those that have tested positive, they are in care, and then we still retain them in care, and they are doing very well. So we have a lot of ways to reach out to them through the community. In each community in FCT, for example, we have a particular team that works there.
They create little impacts by closing the gaps that exist in getting healthcare in these communities, but their efforts have remained like drops in the ocean. Yewande's organization is one out of thousands who focus on providing healthcare support to some selected communities in the Federal Capital Territory.
We pay bills, pay for tests in advance. Okay, we want to pay for 20 women. Like I told you, we are women and children based, pay for 20 women. When we're there physically, if we notice, okay, I think there are sometimes we paid bills for aged before and all that. So the bridging that gap is a massive one. We have a very long way to go. Very long way to go. Even the established hospitals have their own challenges.
Addressing the root causes of these challenges that hamper the effective delivery of health care is what the World Health Organization is urgently pushing for as the world marks the World Health Day. It also calls for a paradigm shift towards promoting health and well-being in preventing diseases.
When we see someone coming, we should already think of intervention in the community that could prevent the same condition reaching others. So that's the concept WHO is trying to drive. So multi-sector policy and action, community empowerment so that they can make the choice, and in inequity, we are also missing that own community participation to contribute to their own welfare and well-being.
Learning from the worst pandemic in recent history, the global health event comes with the need for African countries to protect healthcare systems through the provision of support to build the capacity of health workers to improve health resources and services across all levels. Kemi Balogun, TVC News, Abuja.
For more on World Health Day, lead physiotherapist and co-founder Health Better, Daniel Olubome, joins me on the news this hour. Thank you so much for joining us. Much have been said about Nigeria's health sector, one of which is the primary health care performance. How would you describe the current state of primary health care financing in Nigeria?
Well, thank you very much. I think currently Nigeria is a bit off the mark in almost every sector of the society. The infrastructure is weak. The primary education is debased, and as a matter of fact, there's an inability to provide good and quality healthcare for millions of Nigerians. In Nigeria, access to good healthcare is a nightmare for most Nigerians, and it's one of the many reasons why Nigerians do not blend well with atheism. Here in Nigeria, we still have to pray for good health. But then, the current state shows that there's enough ensuring that there's hardly falls on the government, and the government is always a problem. There's inadequate funding of the existing agencies, hospitals and other parastatals for optimal service delivery. And government cannot be kicked out of the struggle to provide good and quality healthcare. because they have actually proven their ineptitude over time. But their role can be limited to certain areas to maximize values and impact. There are several aspects of the healthcare value chain that the government can actually consider to lead to either communities and other private enterprises. But at the same time, some opponents might want to argue that these will actually drive up the cost of healthcare.
Right.
But free market principles
Dr. Olubumi, very quickly, looking at some of these challenges, identified, how important do you consider government involvement in, primary healthcare financing, and what steps has the government taken in this regard?
Well, I think funding is very much important because at the same time, a lot of the government has actually paid so much focus on building physical structures, which is not so, because how would you build physical structure? For example, you build, for example, in Oshu State, and the last administration, they built over 300 primary health care centers. And without them thinking about who are those people going to work there, the medical equipment, get what's it called now? The systems, the people that will work there, then the services that will be rendered for the people. So you need to put all the sectors, all the systems into place. Then funding is very much important. So primary health care center actually goes beyond just like building physical structures. It's also like basically it's the solution is basically putting into place the framework operations also. So which is actually very important. So and I think that's one of the major challenges: inadequate funding of the hospitals and parastatals.
Right, so many issues, especially with government, leveraging technology to improve the primary health care service in Nigeria. Well, too much to talk about, but then we have to leave it here. Lead physiotherapist and co-founder Health Better, Daniel Olubumi, thank you so much for your time.